3, 2, 1. Let's talk numbers again. How much does the world spend on health each year? $1 in every 100? 5? No. According to a new report on global health spending published by the World Health Organization in 2015, the world spent close to 10% of global GDP on health. That is $1 in every 10 invested in health, for instance, to pay for health workers, facilities, or medicines. Piled up, that 1 in 10 amounts to $7.3 trillion. It sounds like a lot of money, and it is. What's more, it's getting bigger, by 4% every year between 2000 and 2015. And it is increasing even faster in poor countries with a 6% growth per year. In fact, what people call the health economy is growing faster than the global economy itself, which expanded by 2.8% per year over the same period. But there is a problem. According to WHO, global health spending remains very unequal. For example, although more than 80% of people live in low and middle income countries, they see less than 20% of total health spending. That means that many people across the world are at a risk of falling into poverty traps because of health expenses often paid out of their own pocket. WHO estimates that this is the case for more than 100 million people each year. And another staggering figure, more than 50% of the world's population does not have access to health services when they need them. In high-income countries, 7 out of $10 spent on health come from government or social health insurance, while the other 3 come from private health insurance or out-of-pocket payments. This number drops to 5 in 10 in over 100 middle-income countries, covering 76% of the world population, leaving it to individuals to cover the other half of the cost. In 30 low-income countries, the government pays around $2 in every 10, less than in the year 2000. $3 come from external aid, which leaves people to shoulder nearly $5 of the burden of paying for healthcare. So, what needs to change? One obvious way to change things is for governments in countries that spend little to spend more. And it is clear that many of the countries that have benefited from economic growth over the past decade could be spending more. Keeping a close eye on health spending is an important part of making this happen. Better data drive better policy and improve accountability. WHO and its partners are committed to working with countries to improve the availability and the quality of the data at their disposal.